Well, good morning, everyone, and thank you for being here. Before I begin, I want to thank all the frontline healthcare workers, the nurses, doctors, and all staff, those working around the clock to keep our communities safe. You are the real heroes. I'm here today with my Minister of Health, Christine Elliott, Finance Minister Rod Phillips, and Minister of Labour, Training and Skills Development, Monte McNaughton, and our Chief Medical Officer of Health, Dr. David Williams. The situation, my friends, we're facing has changed quickly, and we're adapting with it. Today, my Minister of Finance will provide an update on how our government will approach the province's finances, given the devastating global economic impacts of COVID-19. The approach he outlines will build on the important announcement we're making here today. My friends, these are unprecedented times, but in difficult times like these, we learn a lot. We learn a lot about who we are as a people. We learn a lot about what Ontario is made of. And during these difficult days, it's been amazing to see communities come together. People out there looking out for each other, having each other's backs, looking out for their neighbors and family members, looking out for those who are vulnerable. And the reality is, we're facing some rough waters ahead. But we will get through this together. We've been taking decisive action based on the advice of Dr. Williams, Ontario's Chief Medical Officer. And let me be clear, the health and safety of the people of Ontario is our top priority. We're prepared to do whatever it takes. And we are taking every step possible to slow the spread of this virus. And we need our partners to do the same. I am very concerned about reports we've been hearing at the border. We need the federal government to tighten up the border, ensure that proper screening and protocols are being enforced, and be prepared to take even greater steps to protect the health and safety of all Canadians. Here in Ontario, we're closing all schools until April the 6th. We've set aside $100 million in contingency funding for COVID-19, in addition to $200 million from the federal government. On my direction, we have a $10 million public awareness campaign. Ads will run on TV, radio, and cultural media, and online. Because keeping the public informed is one of the most important things we can do right now. We're also providing additional resources for public health units and hospitals, such as enhanced access to screening, expanded lab testing capacity, and new measures to keep frontline workers safe. We've opened 17 dedicated testing centers to take pressure off our hospitals. And yesterday, we released a new online self-assessment tool. You can find this at ontario.ca/coronavirus. This is an excellent resource, and we encourage the public to use it from home. Before visiting a COVID-19 testing center, please, I say please, use this tool to determine if you need to seek care. And please don't visit an assessment center unless you're showing symptoms. Keeping our seniors safe right now is one of our top priorities. And that's why we've told long-term care homes to limit non-essential visitors and step up screening procedures at the door. This situation is changing rapidly, but I want the people of Ontario to know that your government has your back. We're looking out for Ontario workers and families during this difficult time. We need to support the workers affected by this. A lot of people can work from home, but we need to protect the people working the line or doing shift work who don't have that luxury. And the last thing we want right now is for people to worry about job security. That's why I've asked our team to start drafting legislation to protect workers and families. If this law is passed, it will ensure that if you are in quarantine because you're experiencing symptoms or you've been asked to self-isolate, you will not lose your job. If you're a parent and you need to stay home to look after the kids while schools are closed, you will not lose your job. And we're going to remove the requirement for a doctor's note if you are in isolation at home due to COVID-19 symptoms. I want to thank the business community who have already taken steps to keep their employees and customers safe. And as Minister Elliott and I said over the weekend, we need to have each other's back right now. Check in on seniors and those most vulnerable. Make sure they're okay. And I will say this again, there's no need, I emphasize this, there's no need to rush out to stores and to panic buy and hoard essential items that we will need. I've personally spoken to the vast majority of major retailers in Ontario, and they've assured me that our supply chain is currently able to handle the additional pressure. When I spoke to these retailers, the first thing I said was, what can the province do for you? By the end of the conversation, many of them were offering services within their organizations to help with capacity and additional resources for the people of Ontario. Everyone in Ontario has a part to play. And I want to thank the business community for their leadership at a time when it matters most. There's plenty of food and household essentials to go around. Be prepared, but let's make sure there's enough for everyone. As Canadians, we need to continue looking out for each other. And that's exactly what we're doing with today's announcement. I'll hand things over to Mr. McNaughton now to share more details about the legislation. And again, thank you for coming out.
Well, good morning, everyone, and thank you very much, Premier. The health and safety of people in Ontario is our government's top priority. In this time of uncertainty, we need to support workers who need to isolate or quarantine themselves or need to care for loved ones. No one should lose their job because they listen to the best advice of medical professionals. This is why today I'm announcing our government will introduce legislation that, if passed, will amend the Employment Standards Act to provide job protection for employees unable to work. That includes employees under investigation, supervision, or treatment for COVID-19. It includes workers in isolation or quarantine. It also includes workers who need to provide care to a person for a reason related to COVID-19, including for a school or daycare closure. This measure would be retroactive to January 25th, 2020. It will be in place until this disease is defeated. In times like this, we need to act reasonably. We need to act with compassion, and we need to stand together. Mothers and fathers must be able to take care of their kids. People who may be infected should be able to do the right thing and make sure they don't spread the virus by self-isolating. Nobody should lose their job because they're following the best available medical advice. Workers still have responsibilities. They'll be required to notify their employer as soon as possible if there is a need to avail themselves of this leave. The federal government provides 15 weeks of sickness benefits. They recently waived the 1-week waiting period to access those benefits. The legislation we are announcing today will protect jobs for as long as this disease persists. This is a fair and balanced approach. This morning, I reached out to my federal counterpart, the Minister of Labour. I'm eager to work with her to ensure workers and families get as much help from the federal government as possible. We recognize both the concerns of workers and the substantial financial burden businesses are facing as a result of COVID-19. For weeks, the Deputy Premier has said employers should be reasonable when it comes to sick notes. Our proposed legislation would make it crystal clear that workers cannot be required to provide a medical note if they have to take a leave from work. Again, this measure would be retroactive to January 25th, 2020, the date the first presumptive COVID-19 case was confirmed in our province. The legislation we are introducing reflects an extremely progressive approach. It is not time-limited. It provides robust protections for workers. Our government recognizes the needs of mothers, fathers, and all workers in these uncertain times. We're going to build on this work to support all the people. Clearly, the evolving COVID-19 situation is impacting the way we work, but it also is having an impact on Ontario's economy. Now I'd like to call on my colleague, Finance Minister Rod Phillips, to update you on the actions our government is taking on this front.
Thank you, Monte, and good morning, everyone. This morning, I'll provide an update on our government's plans for the 2020 budget. The events of recent weeks have caused anxiety for individuals, families, and businesses across the province and around the world. As I said last week, these developments are the latest reminder that Ontario is part of an integrated global economy. As Premier Ford has made clear, our government will ensure the necessary resources are in place to protect the health of people and our economy in this province. Circumstances have changed rapidly in recent days. Markets around the world are volatile. Employers and workers are feeling the economic impacts. And the World Health Organization has declared COVID-19 a global pandemic. During that time, I've been in frequent conversations with various experts, my fellow finance ministers, business and union leaders, and my colleagues here at Queen's Park. At the request of Premier Ford, I've convened a regular meeting of the ministers in our government who share economic responsibilities. The work of that committee includes reaching out on a daily basis to leaders at businesses big and small, including our financial institutions, as well as unions, to ensure we have the latest information and that there is an open line of communication as the government works to address COVID-19's impact on our economy. In response to the events here and at home and around the world, private sector economists have revised the economic outlook used to develop the Ontario 2020 budget that is scheduled to be released next Wednesday. As Ontario's finance minister, it's important that I introduce a financial plan for the province that is as current as possible given the dynamic situation. So instead of a full budget, I will release an economic and fiscal update on March 25th, based on our best understanding of the current situation. This update will include a realistic one-year outlook based on current economic projections. It will provide certainty for hospitals, schools, municipalities, and other partners for the year to come. Our approach will include increased resources for the healthcare system, direct support for people, and action to protect jobs and our economy. This is a responsible course that maintains confidence and stability while providing the flexibility to respond quickly to changing events. We will build on our record of transparency with regular financial updates as the situation evolves. We will ensure that the people of Ontario are informed by the most up-to-date information that is available. And as you all know, that information is changing rapidly. It will also allow us close collaboration with our partners, including the federal government, to protect Ontario's economy. Experience has shown that this work is most effective when governments collaborate, and that's exactly what I've proposed to the federal government. I was pleased to sit down with my colleague, Federal Finance Minister Bill Morneau, in Ottawa last week. We've stayed in close contact over the weekend, and I'll be participating in a call with all provincial finance ministers later today. Our government will make additional resources available to ensure Ontario's healthcare system is able to respond to any scenario. Our healthcare professionals have our backs, and they can be confident that their government has theirs. Finally, I want to reiterate Premier Ford's commitment to support people as we address the challenge presented by COVID-19. From washing your hands to checking in on the most vulnerable among us, the people of Ontario are acting responsibly and doing their part during this global pandemic, and their government will do its part as well. Premier Ford and Minister McNaughton just spoke about some important measures in this regard. Ontario has strong economic fundamentals. We have more fiscal flexibility to respond to these sorts of global events through the actions that our government has taken over the past 18 months. I'm confident that by acting decisively and working together with our partners, Ontario is well positioned to weather the challenges ahead. Thank you, and I'll turn it back over to the Premier.
We'll take questions at the mic. One question on follow-up. We'll start with Cynthia on the right and then alternate between the two microphones. Cynthia?
Premier Ford, other areas, we've been told by the federal health minister that we have a very narrow window to control this or attempt to control this. Other areas are shutting down restaurants, anything that is non-essential. Is that on the table? Are you considering it? Do you see that coming soon as a measure?
Well, I can say everything's on the table, but we take our advice off the Chief Medical Officer and take his direction moving forward, similar to what we did when we closed the schools. He gave us advice that the schools should be closed. Within an hour, we closed the schools. But this is changing rapidly, Cynthia, and we will take it day by day.
Are measures being put in place right now to actually be able to implement that if it comes down to it?
Well, again, we will make decisive action once the Chief Medical Officer tells us that we need to shut it down. We'll shut it down. Thank you.
Oh, sorry.
Yeah.
Sorry, I spoke with U of T epidemiologist Dr. David Fissman this morning, who's very critical of the public health leadership in the province right now. He says the window of time in which Ontario can prevent ICUs from being overwhelmed is rapidly closing or may have already closed because Ontario has been too slow to implement strong enough social distancing measures. What is your response to that?
Well, I'll pass that over to the Minister of Health to answer.
Well, I want the people of Ontario to know that we've been watching the situation very carefully. I won't even say day by day, it's really hour by hour. And I would ask Dr. Williams to come forward with a few comments because we are speaking about this constantly. We know that we are dealing with a narrow window to take action, and of course we are prepared to do so immediately if we need to. Dr. Williams, would you come forward and make a few comments on that issue, please?
Thank you. And certainly the aspects around modeling is a useful tool to use in scenario design. And we continue to use that to drive our decisions about planning so we can be proactive in those areas and to use that for forecasting. As always, you have to go back to the data, what is actually happening. And we try to assertively deal that daily with our testing. Within our testing mandate and how well we have our equipment and supplies, as well as advice to the public in all those regards. I think if you look at our performance thus far, because there was projections, even with our first cases back, as Ms. McNaughton said on the 25th of January, that we were already 2 to 4 weeks late. And where were we then at that time? And so if we use that projection, we would have seen already much more consequences. I think the goal of our public health, doing the intensive contact, because before social distancing, as the consultant with the WHO has spoken, your key thing, if you can do it, is containment. And do you have the resources to do the case management contact follow-up? And we have been doing that assertively, both through the wave first from the aspects in China, and then with the Iranian aspect, where we do have large populations at risk here in our GTA. And so now we have our new one, related to cases coming back from USA with positivity. And so how do we handle that? So I think you have to apply the model into how do we fit in that? Is it apply with all the variables and different things? So I think it's always good to have those models. It always prompts us to think about those, to prepare and to get adequate rest. And we're doing that through our command table and many aspects around there, because there's a lot of components to that to be prepared, including the social distancing that we have put in place, that we have considered and we will consider put in place in partnership with my peers across the country, so we have consistency so that our Ontario public and our national Canadian public continue to do the great job they have in participating and working at this in great energy and effort. And we really depend on that, and we need everyone to pull hard at this time.
To follow up on that, he also says that the public health leadership in this province has been poor at communicating, unclear about the facts on the ground, and giving Ontarians little practical guidance about what they should do. What is your response to that?
Well, we do have active communication with the public right now. We do have the website, ontario.ca/coronavirus. We are updating that constantly, several times a day. Dr. Williams is going to be doing daily updates for people about what's happening. We also have posted a self-assessment tool on the website. So if people are concerned about their symptoms, they can go through the self-assessment checklist. If they still have questions after that, they can first of all call the local public health unit. They can call Telehealth Ontario. We have just ramped that up significantly, adding more people who are health professionals to that call list so that people can receive answers in a timely manner. And of course, we've changed the K codes for physicians as well, so they can call their family physician and get advice over the phone. We're asking people to do all of these things before they come to an assessment center for testing, because we know that many of their questions can be answered in that way. We are also embarking, as the Premier indicated, on an extensive public campaign with radio and television ads and print ads to make sure that this information is available easily to people and that they can act in a timely manner. Thank you.
Hi, Premier. You said in your remarks you're concerned about the border. You're calling on the federal government to tighten it up. What specifically are you talking about here? Do you think we should close the border with the United States? Are you referring to lax airport screening? And also broadly speaking, how do you think the federal government is doing in coordinating measures with the provinces, as we've seen kind of uneven guidelines across the country? Do you think they're doing enough to impose standardized measures that each province should be following?
I had a conversation yesterday with Deputy Prime Minister Christine Elliott, and I'll tell you right now, she's working around the clock. I'm a big fan of Minister Freeland. She's communicating constantly, not just with myself, but other premiers. I know when I had a conversation with Premier Legault from Quebec, he was encouraging the federal government to close the borders. Christia asked me about that. I'd be okay with closing the borders to visitors, not to trade and commerce. We're doing $1 billion a day in two-way trade. We have to keep the supply chain moving, but that's a call for the federal government to make, not the province, but we would support that if they were to do that. But I would like them to, as I mentioned on the phone yesterday, at least give a day or a couple days notice to people outside the country. Keep in mind, this doesn't mean closing the borders to Canadian citizens. Constitutionally, you can't do that. But we would like to give people notice, especially people overseas, to catch a flight home.
Just to clarify, you mean closing the borders to anyone coming from any country?
Well, again, closing the borders, meaning the U.S., or not to visitors. I want to emphasize that, to visitors, not to trade and commerce. We have to keep the supply chain going. Again, as I mentioned in my speech, I want to compliment the business community. I want to compliment the retail folks that I've talked to over the last few days. They're assuring us that there are going to be supplies on the shelves. And I want to emphasize, not to panic, not to hoard. I had an opportunity to talk to Mr. Irving from Irving Tissue. There's plenty of toilet paper. We just have to get it. We have to get it in the stores, and that's what we're focusing on, restocking the shelves right now.
And just quickly, Alberta announced that it would be closing schools indefinitely. Is Ontario considering or open to such a measure here? Again,
I'll take my advice off the Chief Medical Officer. If he feels that is necessary, then we'll follow that advice. Right now, we've closed them till April the 6th, and we'll take it from there. I just want to emphasize, things are changing rapidly, hour by hour, day by day. Things are changing.
Hi, Premier. Some people have called for evictions to be put on hold so people aren't put out in the streets during this pandemic. Do you think that's a good idea?
Well, again, everything is on the table. We want to protect. Our number one priority is to protect the people of Ontario, no matter if it comes to their hydro bills, if it comes to evictions, if it comes to job loss. We want to make sure we're there to protect them, and we'll make sure that we have their back.
But just ethically, do you think that's a good idea to put evictions on hold?
Again, we will be reviewing everything. Everything's on the table, and we want to make sure everyone is protected.
And with regards to the measures you've announced today, sick notes and job protection and stuff, we're obviously in a worldwide crisis right now, but people have personal crises all the time. You know, if you need to implement these measures right now, doesn't it make sense to have them in place all the time?
Well, again, in these situations, we're going to make sure that we take care of the people, make sure we protect workers, and as we move forward, things will change based on the situation we're facing and the advice that we're getting from our health experts.
On the issues we've seen at the airport that you were flagging, we've seen Quebec has sent some of their own public health officials to go and help supplement. I think that comes from a place of mistrust. Is that a thing that Ontario would consider doing to help out at the border?
Well, I'm the biggest fan of the frontline men and women at our border. They're doing an incredible job. They may need a little more direction from the federal government, but we will work hand in hand and offer any help we can to the border services.
In terms of practical advice, there have been some concerns about people whose driver's licenses are coming due. They have to have a photo taken to renew their health card or renew their license plates. Is there any measures being considered to give a grace period for that? Should they be going out to renew those things in this sort of uncertain time, or where they might be focusing on self-isolating?
Well, we're looking at online services right now, similar to hunting license, fishing license, but we are reviewing that. I had a conversation with the Minister of Transportation, Caroline Mulroney. We're going to do everything we can to make it easier for people to get their licenses and renew licenses. So that, again, that's on the table, and we'll take decisive action moving forward on making life easier for people in getting their licenses.
Hi, Premier.
Hi.
Obviously, we're seeing different provinces taking different degrees of precautions at this point. In your conversations with the Deputy Prime Minister and with your fellow premiers, has there been any conversation about trying to limit interprovincial movement, and how could that happen with sort of the porous borders that we have?
Well, that hasn't come up right now. We're focusing, everyone's focusing on their province, and obviously the federal government is focusing on the entire country. But again, I want to reinstate, I have all the confidence in Chrystia Freeland, the job she's doing. I want to give my confidence to the Prime Minister as well, and wish himself and Sophie, his wife, a speedy recovery. But he, as far as I'm concerned, he's showing good leadership as well.
And just in follow-up, we saw reports this morning that Israel is looking to use cell phone data to help with contact tracing. Is there anything like that being considered in Ontario? Is there a possibility of using that kind of data to assist public health?
Well, I know Rogers has reached out to one of our ministers, and I'm sure Bell. They've offered all resources to help us out. We want to thank the business community for stepping up to the plate, and everything's on the table right now.
Hi, Premier. We've been talking about the government of Quebec a lot, the measures that are being imposed, such as no more visits to hospitals or long-term care facilities, closing bars, movie theaters, libraries. They declared sanitary state of emergency. And I was wondering, why not impose those more drastic measures and just give advice, instead of giving advice to business owners and organizers?
So just moving forward, any health questions, I'm going to refer over to the Minister of Health and the Chief Medical Officer.
Well, thank you for the question. We are studying all of those measures now because it is a very fluid situation. It's changing rapidly. At the present time, we have imposed the measures that Dr. Williams and the team believes are the safest for Ontario. But again, I'll ask Dr. Williams to please join me. If you could please make a comment on the situation that we're facing in Ontario, when we might, if needed, put these measures forward in the same way that Quebec has.
Yeah, and I think the steps and all the pandemic planning, it's continually ramping up, and you do it in stages so that you do what is appropriate at that time for what you're facing. And I think in this situation here, we already have put in place the screening of all visitors and limitation with long-term care facilities. And we asked retirement homes as well as hospices to do that. We've asked our hospitals to increase their signage and checking on that, as well as their staffing. Because in the end, we're a vulnerable population in the data we received, through the experience in China is our vulnerable population is those over the age of 50, definitely over 60, and those with comorbidities and others with autoimmune or immune-compromised situations. So that if we go further than that, then we have to put even more, I would say, isolation-type aspects around those groups if there tends to be a sense of wide community spread on that aspect there. So right now we have not seen that yet. We're looking for it all the time. We may have to, and that's what's something to do those processes. We have those available. We can move on that if and when we need to.
We have a lot more cases here, almost, I think, doubled in Quebec, and the measures that the government has been taking are a lot less. Why not do more? Why not close bars, restaurants? Like, why not stop whole visitations?
The cases that we have increasing rapidly in that with the large numbers, it's, except for a few, we're still trying to follow the details on it, they're all related to travel. And so those people have brought it in from outside. They're still coming in a timely way to get assessed and handled that way. So we're trying to make sure we're following those ones in a timely fashion. So they didn't get it from a community source yet at this time. We've asked them when they come in that they would not only go to those, they would stay in isolation and they would stay at home. If they're symptomatic and if they have been assessed as being positive, then they're in self-isolation for those 14 days. That's the largest preference, and we've been able to contain that thus far. If it tends to get larger and larger, then we'd have to look at other alternatives to increase the social distancing, is what you're referring to. And some provinces have moved ahead with different ideas and concepts. We have our regular meetings with our special advisory committee of the federal government, and we try to make sure we're somewhat consistent as best as possible, knowing there's some local regional things that are more important that want to be addressed, but we try to make sure we're doing that in a way to at least not confuse the Canadian public and our own Ontario public, but to make sure we're in stride and step with each other. So we'll continue those communications and dialogue and to learn from each other and to see if we can gain consensus on these important matters.
Dr. Williams, this is a question for you as well. Has Ontario asked the federal government for additional supplies for its hospitals, like ventilators and protective gear for frontline healthcare workers? Because we've heard from numerous healthcare workers there is a shortage of supplies.
Yes, we have had a number of discussions with our federal counterparts. In fact, there's another conversation happening this afternoon with the Minister Haidu, as well as my provincial and territorial counterparts. I think that everyone is thinking about supplies, not knowing how long this will last, making sure that we have the necessary PPE and the testing swabs that we need. The federal government has agreed to coordinate the overall supply, and so we are in close contact with them on that subject, yes. Thank you.
A question for Minister Phillips. Minister Phillips, I'm wondering, when it comes to the budget, you've indicated that it's at the very least delayed. You'll have a mini budget next week. When is your target date for the release of the full budget, and are you worried about the signals that that could send to the markets?
We think the responsible thing to do now is make sure that we have a clear plan for the next year. So the document that we will release, the economic and fiscal update next Wednesday, will indicate that. What that will let partners like municipalities, hospitals, school boards, and others know is what resources are going to be available for that year. It also lets us outline the plans from our perspective that are going to be required to support workers and companies and make sure we're supporting people. In terms of a full budget, our plan would be by the fall at the latest to release that. Obviously, what we need is a more stable economic situation and scenario to be able to look out multiple years. But in terms of the content of the document we'll release next week, it will give all the information that our partners need. So hospitals will know the resources they have, municipalities will know the resources, and it will also give us a chance to outline what we're going to be doing to protect people and support action in the economy.
Follow-up actually for Premier Ford. This is on the labor legislation. We're hearing a lot about social distancing these days and the need for that. How logistically will the House be able to pass this legislation if social distancing is in mind? I mean, will it be a recall of part of the House, some MPPs? How will that work, and what's the timeline for that legislation to pass?
Well, we're going to be working with our partners, official opposition, also work with the Liberals and the Green to make that decision. I see that Mr. Del Duca is here. We had a great conversation this morning, communicating with them, and our goal as a government is to work side by side with the other three parties to move forward. Thank you.
I wanted to ask what measures are being considered for the poor, people on disability, people who are on social assistance. They might live in social housing, low-income seniors, people who don't have the financial wherewithal to compete with the general public on buying enough supplies, or who may live in very close quarters and don't have the luxury of social distancing.
I'll let the finance minister.
So Antonello, as the Premier said, we're looking at all the options in terms of supporting Ontarians. We are also working, and I've spoken to Minister Morneau to ensure that we're coordinating with the federal government, and I know Minister McNaughton as well has spoken to the Minister of Labour. So we're going to work in coordination with the federal government to make sure that the supports that are required are in place, and obviously that's one of the reasons why we needed to recast the fiscal and economic statement next week.
And a follow-up question just from my colleague Brian Lilly. It's very practical. What are snowbirds supposed to do? Are they supposed to come back?
Dr. Williams, what's your advice?
Well, it's a good question. We're trying to get some direction from the federal government. We are waiting for some announcements to see what they might say on that behalf. This is, as you know, a large contingency, and we're seeing the number of Ontarians, at least, coming back in ever-increasing numbers. Unfortunately, a number of them, after a few days, have been found to be positive from different parts of the USA. So we're not really clear exactly what the status in each of the states and where the places where snowbirds might be coming from, whether it's high risk or low risk areas. We're waiting for further information from Public Health Agency in Canada on that, as well as with CDC, to give us some guidance about how we might participate and on a comprehensive screening and management process.
Does that mean staying pat until, if you have that option to stay where you are until that advice is available?
The last thing is the federal government's had asked people who might want to consider returning. We are trying to get some clarification. We know in the next day or so of what did the federal government mean by that. So we'll have to wait to see if there's some announcements that would give greater clarification and detail on that from the federal government's perspective.
Hi, Ministers. I think this might be for Minister McNaughton. I'm just wondering, will the measures announced today for workers help those who might be immune compromised and are risking their health by continuing to work even if their employer is still running?
So our message is clear today. The legislation that we'll table will ensure that those workers can remain at home and those jobs will be protected. We stand shoulder to shoulder with every worker in the province and their families who are going through obviously a very challenging time. As I said in my remarks, this will be the most progressive legislation anywhere, at least that we've seen so far, when it comes to protecting jobs. Most jurisdictions are introducing legislations that's time limited. Ours is not time limited.
I understand. Just one follow-up. You're protecting jobs, but will workers continue to be paid even if their jobs are secure?
So we're working closely with our federal partners to ensure that in many cases EI will cover these workers across the province. That's why I said I've already reached out to the Federal Minister of Labour, and Minister Phillips has reached out to Minister Bill Morneau. But we want those workers to know that we'll be with them every step of the way. We're going to protect their jobs, and we're even going as far as making it retroactive to January 25th, which was the first presumptive case in the province.
Okay, so employers won't be required to continue to pay employees. That will be happening through EI?
Right.
Okay, thank you.
Okay, I've got questions from reporters who are social distancing, not here, or who are at home self-isolating after taking some very quick trips this weekend. First one is from my colleague Rob Benzie of the Star. When is the House coming back? Will it come back next week? Or are you going to bring back an emergency session to pass any bills this week?
Again, I believe we will, but we want to work with our counterparts here, speak to the opposition, and get input from them as well.
From Sabrina and Angie, Queen's Park today. Do you have any regrets about changing the doctor's notes and sick leave requirements in 2018 in light of the new pandemic? I know Just last week, the Health Minister, you were saying like doctor's notes are really optional, we're leaving that to employers. Why the sudden switch?
Well, we want to make sure that all of our resources are going to be spent on dealing with people who do have COVID-19, and it always has been an option for employers. Now it's officially stated so that everyone knows, because we need all of our healthcare professionals to be dealing with the actual cases that we're dealing with. We do need all hands on deck for this, and so this will allow for our health professionals to be able to do that.
All right, so what you're saying is the situation has changed enough that you changed your mind?
It hasn't been a change of mind. It has always been optional, has been mandatory to have employers' notes. But now it's widespread knowledge. I think there might have been some confusion perhaps before, but this is clarifying what the state of affairs is so that our health professionals can do the work at hand.
Okay, and now from Colin DeMello from CTV. Energy bills are going to be high for a lot of families who typically aren't home during the day but will be now. Is the government considering a suspension of time of use and moving to a lower flat rate time of or pricing for hydro through the day so that people don't end up with even higher electricity bills once this is over?
Yeah, so the off-peak hydro rates, we're working with our Minister of Energy. I think I mentioned that last week in an announcement, but we'll be working with people to make sure the most vulnerable are taken care of. I've never been a fan of these off-peak hours, back and forth, people working all day and having to do their cleaning and everything at 8 o'clock, 9 o'clock at night. We're going to adjust that.
Okay, how soon will we see that?
Again, you'll probably see it over the next little while, but we're in full communications with our Minister of Energy, and we've been in communications about this last week, making sure that we have a fair and sustainable hydro rates for the people of Ontario and businesses.
Okay, thank you. Now from Mike Crawley at CBC, and a few other reporters have had this in mind as well. And maybe it's for Christine or for Dr. Williams. The website has a lot of cases, listing the cases has a lot of the cause for the cases pending. I think today they're all pending. Does that mean, and there were a few the other days, does that mean that they're all community transmission? Because in the past, it's always been pretty quick to say travel-related or close contact with someone who's travel-related. So what does pending really mean?
So on our slip, we always have pending, there's two pendings. One is the one where the lab has received the specimen and hasn't yet processed it. So we always have total samples received, and we have pending, we have the positives and resolved on that one there. The lab samples have gone up extensively, heading up to around 1,800 to 2,000. As you can imagine, in a day, that takes a while to get through all those. At the same time, we've opened up some alternative sites that are doing lab testing, and some of those are trying to get up to speed on all the requirements to fill in the database point about not just age and sex, but also travel history, risk history, and those are pending when the public health completes that investigation.
Okay, do we have community spread? Ottawa Public Health is saying today that they have community spread, so I'm wondering why I'm not hearing it here from you.
I think when you say there's community spread, then we have to have evidence, and so far the ones we've seen, when they do their complete investigation, they usually have some contact with a case in the past or other risk activity there. It takes a while to undertake that full investigation. If you have a case in the community that where you don't have any history of travel, any history of contact with the case, that requires that you then assume that that person got it from some community-based source, and you have to do a wider investigation of all those close contacts and ascertain who else who was in relation to that case close, because that's we've seen our spread, is also positive that may be unmissed. And so that takes a lot more investigation to do, and they're undertaking that to see, do we have any clusters? So far we haven't determined that and seen that. I think I have to say that Ottawa, their position of their medical officer said, based on modeling, they're assuming they might have 1,000 cases. They didn't say they definitely did. So it's again using the term modeling to give some perspective of what they might think they're facing, but those are not based on hard data points yet at this time.
Okay, so while you're up, we have another one from a couple of reporters. Why is Ontario not taking more proactive measures at this time like some US states are in terms of closing bars and restaurants? Premier Legault announced yesterday those kinds of things, restaurants having to reduce their number of patrons by half. And are we anywhere close to needing to declare a state of emergency?
So we have, well, you already answered the bar one. Because the next step we could do, we're looking at some directions from other sectors, including the American sector of, we moved from our large gathering from 1,000 down to 250. There's some sense, do you want to move down even smaller? And that has an impact after a while in certain bars and restaurants where it would be untenable for them to keep operating that basis there. So those are new breaking type ideas and concepts, and some have led the way, as we did with school closures in one aspect. Some have followed suit in that respect. So each of our provinces and territories are undertaking actions in the social distancing that they feel are necessary at that time. And then we discuss those at our federal, provincial, territorial table to see can we come with consensus across the whole country to come in agreement with that as a special advisory committee, informing both the federal ministers as well as the Prime Minister and our own respective jurisdictions.
Tomorrow is St. Patrick's Day, though, and could be a lot of people out. Is that a good idea for people to go in a crowded bar on St. Patrick's Day?
We're recommending people be very cautious about that make your own judgment. If you have any concerns, of course, be in touch with your local public health unit if you're holding an event, but certainly we would discourage people from going into large gatherings tomorrow as on any other day. We want to make sure that we can keep the people of Ontario safe and healthy. I think to answer the latter part of your previous question, as the Premier has indicated, we're going to do whatever it takes to keep the people of Ontario safe. And so you asked about closing all bars and restaurants and declaring a state of emergency. If we have to do that, and that is something that is always being discussed, we will do that, but we don't believe we are at that stage yet. But this is a rapidly changing situation, as everyone knows.
One more. From Mathieu Simard from Radcan. Feel free to answer in French and English. Did the government manage to increase laboratory testing capacity in the last few days? How many tests can you process every day? And will you have to move to testing only vulnerable people if you can't do or process enough tests?
We are rapidly enhancing our lab testing capacity as well as our testing facilities period off-site from hospitals. We are making sure that they're expanded across the province, but we certainly want to make sure that we can continue with the testing, and we are having more test centers being opened or lab centers being opened. So absolutely we're going to, any tests that have been conducted, we are going to process all of them.
I think Dr. Williams said last week, I think you can do 1,200 a day now.
Dr. Williams, would you come forward, please?
Last week, that was true. This week, we've added more sites, so we're well over 2,000 now. And it's hoping in a short while, we'll be up to 5,000. We're heading for that.
Okay, thank you.
Thank you, everybody.
Thank you.